I was raised in a family of physicians, and it was really inspiring to see my parents and my grandparents, uncles and aunts come home and talk about their days and how they made a difference in somebody's life. And that's something that I've always wanted to do. And actually, one of the reasons that I got my MBA was so that I could apply different principles, specifically business principles, principles of standardization, to improve patient care. So I was born in Uzbekistan. I grew up in New York and have really traveled throughout the country for my various aspects of training. I spent my collegiate years at Northwestern here in the Midwest. Went back to the Northeast to Dartmouth for my medical school and business school. Then went to California in San Francisco at UCSF for my residency. Then went back to New York for my fellowship training at Hospital for Special Surgery. So have really kind of been all over the place for various facets of training. And now I'm excited to be here at WashU. I think there are a few reasons that patients should choose WashU. And all of the reasons really come back to the patient themselves. I think the first thing is that the physicians here at WashU are absolutely stellar at direct patient care. I think secondly, this institution really focuses on research and translating that research and bringing it back to patient care. And I think third, we are focused on training the next generation of physicians so that they can also take great care of patients. So ultimately, I think WashU is very patient-centered, and all aspects of what we do go back to how can we improve the lives of our patients. Having had an active childhood, I had fractures, I've torn my meniscus, all those things led me to an orthopedic surgeon. And that experience with the orthopedic surgeon ultimately was very pleasant, and I think greatly impacted my life and ultimately my career decision. Also, having had grandparents undergo knee replacement and joint replacement, I was able to see what kind of a difference that can make in their lives, and that also further drove me to kind of explore my interest in joint replacement. And what I hope to really specialize in within hip and knee replacement is technology-assisted joint replacement. This is really not a field that a lot of surgeons are currently involved in, but it's one that's evolving. And I look forward to offering some of those benefits to my patients, and also doing research to really evaluate the technologies that do or don't make a difference in patients' experience and their lives. Seeing a patient return to their level of function, or their desired level of function, seeing them recover from their injury, it really just means everything to me. It's what all these years of training, all these years of education have been for, and to see that culminate in an actual patient's life and experience is really, really gratifying.